Good afternoon, everybody, and welcome to our first Speaker Series event for the Center for Practice Excellence for 2024. My name is Zubin Austin, and I am the Academic Director for the Center, and it's my great pleasure to welcoming you to the start of this year's programming, and a very exciting start we have. I'll turn it over to Annalise to introduce our speakers, our topic, and to get our proceedings underway. Over to you, Annalise.
Thanks, Zubin, and welcome everyone. Thank you for joining. Just before we get started, I just wanted to start today's session by doing a land acknowledgement. I wish to acknowledge this land on which the University of Toronto operates. For thousands of years, it has been the traditional land of the Huron-Wendat, the Seneca, and the Mississaugas of the Credit. Today, this meeting place is still the home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to work on this land. So as you know, today our conversation will take a little bit of a different format. We'll have a series of two presentations by Osnat and Marwa, and then we'll have some remarks from Kareem, who is our discussant for today. And then we'll leave lots of time at the end of today's presentation for audience Q&A. I think we're expecting a larger group at today's session. So just in terms of housekeeping, I'll encourage everyone online to just put their questions and comments for our presenters and discussant into the chat, and we'll triage those at the end of today's session. So just to do a few introductions for our presenters, our first presenter for today is Osnat Melamed. Dr. Melamed is a clinician scientist in the Campbell Family Mental Health Research Institute and a staff addiction physician at the Center for Addiction and Mental Health. She's also an assistant professor in the Department of Family and Community Medicine at the University of Toronto, where she holds the 2023 New Investigator Award. Dr. Melamed is an early career investigator with research interests in tobacco addiction and the intersections between substance use, mental health, and gender. Dr. Melamed is interested in the use of technology for the delivery of treatment for substance addiction. Our second presenter today is Marwa Yunus. Marwa is a healthcare strategist and entrepreneur with almost 20 years in the public and private sector, combining technical and clinical knowledge to drive healthcare innovation, systemic change, and equitable access to quality and timely care for all. She co-founded Seamless Care Pharmacy and Seamless Care Digital Solutions, which integrate innovative care models with technology to improve patient care. She also co-founded Polymatics, an AI-powered pricing strategy app for e-commerce retailers. She's the founder of Agate Medcare, a boutique health consulting firm, and Marwa also serves as an advisor at Cadith on their strategy and innovation team. And Kareem, Dr. Kareem Kashavji, trained as a family physician and is the CEO of InfoClin, which is a company that provides health informatics consulting to a variety of organizations across North America. Kareem was the architect and implementer of several community healthcare EMR initiatives, and his current research is focused on how to use artificial intelligence and machine learning, most recently in the service of diabetes prevention. Kareem is an assistant professor and program director for the Master of Health Informatics program at the University of Toronto and a visiting scholar at Toronto Metropolitan University. Thanks for joining us today, Kareem, to provide some remarks on Osnat and Marwa's presentations. So we have a packed schedule, so we'll jump right into it. Osnat, I'll just invite you to share your screen and feel free to get going whenever you're ready.
Okay, thank you very much, Annalise. Okay, you're able to see the slides?
Yeah, perfect, thanks.
Okay, perfect. So hi, everyone. My name is Osnat Melamed, and thanks very much for the opportunity to speak with you today and the opportunity to have this conversation on AI. My brief presentation today will focus on artificial intelligence-based tools for smoking cessation support. These are my disclosures: grant, salary support, no ties with commercial or for-profit entities. So the main topic I'd like to talk with you about today is chatbots. They're also known as conversational agents. And I think, in the age of GPT, I don't think there is, a need to do an introduction. What is a chatbot? It's a software. It's able to converse with users using a text-based chat. And here in the picture, we can see, I guess, one of the ancient chatbots, where a person would put in some information on where they want to fly, and the chatbot would provide that information. So it was kind of initially used as, to replace a search engine. But things have evolved since those kind of very preliminary chatbots. And the older chatbots were what we call rule-based. So similar to the chatbot in the previous slide that helped the person, find flights from Toronto to New York, for example. They could only, provide that information. They did not generate the responses. It was all pre-scripted. And if you entered something, what's the weather today, the chatbot would just say, sorry, I don't understand that, because it was not scripted. The response for that was not scripted. Now, I think, today, again, in the age of GPT, I think we are more and more hearing about the use of artificial intelligence chatbots, which use natural language processing, and as a result have sort of a mind of their own. They are able to generate responses that are not scripted and can sort of learn and adapt to create better and better responses over time. So what I'd like to share with you today is chatbots that we are using to help smokers quit smoking. And I think the rationale for this is quite clear. We know that people do better when they receive behavioral counseling for smoking cessation and, of course, medication. But we also know that, as busy clinicians, and a lot of you here on the line today are frontline clinicians, very busy, it's hard to find a time to actually provide a person with that counseling on how to change smoking behaviors. What are my triggers? What are my coping strategies? And the thought is, can we automate a smoking cessation conversation? Can a chatbot provide a smoking cessation conversation? And whether this will be effective, whether this will be acceptable to the patient. We know that smoking cessation chatbots are already here. They're a thing of the present. It's no longer science fiction. And this is a review that was published in 2013, looking into 13 smoking cessation chatbots that were tested on quite a large group, over 8,000 people. And interestingly, we see that a meta-analysis of 6 of those studies showed that they were quite effective. I mean, all the studies reported positive outcomes. And we see that the results are, 66%, people are 66% more likely to quit or reduce their smoking. So we know that chatbots, at least the ones reviewed here, were effective. Now, we also know that people told us that they appreciated, especially the relational aspect of chatbots. And this is not surprising. This is why people enjoy, working with healthcare professionals, because there is this relationship part that's really important. But we also know that there are some limitations. For example, the interventions were really short, and we do know for smoking cessation you need to talk about maintenance. And sometimes users didn't feel that they and the chatbot were on the same page. They didn't want to feel urged to make a quit attempt, where the chatbot they felt were being pushed to do that. So still room for improvement with regard to chatbots, especially are they acceptable to humans, right, to use. So one of the things that we ask ourselves is, how can we improve chatbots, right? And can we create this, wonderful chatbot that would be similar to a human provider, it would be similar to myself, similar to a pharmacist that's delivering a smoking cessation conversation? Can we do that? So this is the topic of an interdisciplinary collaboration, and you have the main people working on this project, myself included, to build a smoking cessation chatbot that is based on motivational interviewing, and we'll talk a little bit about that. In order to make sure that we have a good chatbot in hand, we wanted to have this collaboration between smoking cessation clinicians, people who developed this chatbot, people who do the software development, but also with social scientists to think about the ethicality of it, you know, and intersection with other factors that could influence smoking cessation. So, you know, as we're developing this artificial intelligence-based chatbot for smoking cessation, specifically the work that we've done is focused on motivational interviewing. So we do want a chatbot to retain as much as possible the human traits, such as empathy and compassion. And that is, of course, increases the chances of a person relating to the chatbot and hopefully, you know, making greater strides towards quitting smoking. So can we do this? Can we, you know, program a chatbot to be non-judgmental? Can the chatbot respect the autonomy of the patients who are not ready, right? Nobody wants to feel pressured or judged for not being ready to quit. And we also, you know, want to actually measure the motivation, right? Does the motivation increase from conversation to conversation? A little bit about the work that we've done with this chatbot. You know, our aim was to develop and test an artificial intelligence-based chatbot that would mimic a motivational interviewing practitioner, and we would like to see some effect on the level of motivation a person has for quitting smoking. So, you know, we use the readiness scales, the 0 to 10 readiness scale, in which we ask people to rate their readiness to make a change to their smoking behavior. And we know that high scores in this scale are predictors of, you know, future smoking abstinence. Definitely, if a person comes into this discussion with a chatbot scoring a low number, and after conversing with a chatbot, he leaves kind of with a higher number, we've done a big thing for their health potentially. How did we do this, you know, this study? So we started working on this back in 2018, and eventually when we tested this, you know, the work that I'm showing you, we used actually an older OpenAI model, GPT-2, and today what we have is GPT 3.5 and even GPT-4. So this was a much older model. And what we trained the chatbot to do is to use the linguistic constructs that a motivational interviewing practitioner uses. That would be, for example, you know, asking open-ended questions, you know, providing reflections, and also summaries. And we started with a very basic conversation. So these are the 5 questions that the chatbot, it's scripted, the chatbot would ask, but the responses that the people would give, the chatbot would reflect kind of in a generative way. We did not tell the chatbot what to do, and I'll show some examples. So the 5 questions, the basic conversation is, you know, we ask people, what is it you like the most about smoking? And then what are the things that you like least about smoking? Is there one thing that you would like to change? What would it look like when you've made this change? And what are the steps that you need to take in order to make this change? So this was our very basic sort of MI conversation that we wanted the chatbot to help us with. We had about 200 participants. We used a crowdsourcing platform, and we measured the readiness to quit. How is it before conversing with a chatbot, after, and we also followed up 1 week after. And what we did throughout the course of a year is improve the versions of we trained a chatbot. So we had different iterations according to, you know, what we saw coming out of the chatbot. We can kind of rate whether this reflection or response was a good one, we wanted to continue with it, or whether we should eliminate it. So we could train the chatbot over time. So this is an example of a real conversation that, you know, our chatbot had. You can see the questions here. So those are scripted, you know, questions 1 to 5 are scripted, but the reflections are generative, meaning we did not tell the chatbot to say this, but the chatbot sort of, you know, so for example, to start, could you tell me the things you like about smoking? This person says he likes the aroma of the cigarette, the feeling of inhaling the smoke, and the taste. And the reflection is quite neutral, right? You enjoy the feeling of smoke on your lips and throat. It's sort of a matter of fact. We do not judge, right, a person for, you know, this behavior that's unhealthy. And then we talk about, you know, the question, what would you like? What are the things you don't like? The person doesn't like to spend money on cigarettes. and the chatbot can easily sort of reflect on that. And then we said, what is the things that you would like to change? The person would like to smoke less, and the chatbot is able to, reflect on that and saying you'd like to cut down, so kind of providing a correct reflection. What are the changes that you'd like to take? Question 5 here, I think I need to stop smoking alone and try to smoke only around my friends. And again, the chatbot kind of picked up, we don't have the reflection here, but the chatbot kind of picked up and provided an accurate reflection. So this was kind of a very nice thing to see. One of the things that that we've done behind the scene is having to filter out some of those sort of judgmental responses that we received from the bot. And that was part of the work that we had to do with the chatbot. So for example, if you look at number 4 here, if a person says, what would it look like, when you have made this change in your smoking, let's say, reduce my smoking or quit, and the smoker would say, well, when I change that, I'm going to, be able to breathe easier. And then the chatbot, could answer in sort of in a judgmental way and say, right, and if you don't quit, your breathing will get worse and worse. So this is, for example, the bot could generate these kind of answers. And what we had to do is kind of as the research is really review all the responses that, very long transcripts of what the chatbot could respond and sort of eliminate the ones that were not appropriate, because we wanted to train a chatbot that would be based on motivational interviewing, respectful, not non-judgmental, and helping people move towards the decision to quit. So this work has been done, and recently in the last year published the results of this experiment that we've conducted. And what we can see here is that the readiness rulers. So on the left, you can see that when people approach the chatbot, their readiness to quit or the confidence is quite low. You can see more numbers on the left-hand side, indicating that they have 0, 1, 2, 3 level of confidence. And then as they finish the conversation, we see some increase. And a week later, we see kind of more people on the higher end of the confidence ladder, meaning we see more 6s, more 7s. So the right side of this graph is a bit more populated. So we did find that more people, their confidence increased, and these are the different versions, right? We did iterations where we trained a chatbot, and we can see that overall, the majority of people had some benefit. Their confidence towards quitting increased after their conversation with the chatbot. We had some that it was the opposite, but again, a minority of the patients. And for about a third, a quarter to a third, it sort of stayed the same, which means, did not really do much for them. Keep in mind that this was a relatively short interaction. It was a one-time interaction with the chatbot, but definitely proving that there is some potential, for this to have a meaningful effect, especially if we multiply the intervention, having the chatbot, to talk with on a daily basis, on a weekly basis, we could potentially see, more robust results. Thanks very much. I think I'm going to stop sharing because that's kind of the end of my little piece.
Thank you, Osnat. Yeah, thank you for sharing that snapshot of just some of the work that your team has undertaken. I think it's fantastic to see some of like the conversations and then also sort of the correlation and some confidence change among the users. So it'll be really interesting to see how that work evolves. Marwa, if you'd like to pull up your slides for your presentation next, I'll just invite anyone online. If you do have any questions or comments for any of our presenters or along the way, please do feel free to pop those in the chat. Okay, thanks, Marwa. I'll turn it over to you.
All right, thank you. You're able to see my view without the presenter view?
Yes.
Okay, perfect. Okay, so hello, everyone, and thank you, U of T, Leslie Dent Faculty of Pharmacy, for having me today. Thank you so much, Dr. Melamed, for that really interesting perspective on really the practicality of developing an AI solution. So it was really like, thank you for that. Today I'm going to take a bit of a different approach. Let me just make sure I don't have the time. And so I'm going to kind of pull it back up and kind of give more of a horizon scan. So I don't see myself as a technical expert when it comes to AI. I really kind of a self-proclaimed futurist. What I love about AI is the possibilities, and I'm probably more of a bit of a product person. So I'm somebody who brings a certain expertise, whether it be pharmacy or drug management or anything really, and is able to somehow try to translate the problem to more of the technical perspective. So I think that's a really important role to be played right now, where is somebody that can understand the opportunities, as well as, you know, some of the limitations of the technical aspects of developing an AI solution or any types of digital health solution, but is also able to define the problem from a way that makes sense. So a bit about my background, Annalise, you've already shared some of it. So I'm going to start with, I think it's really important to remember where we started to kind of explain my passion of AI and where it's going to take healthcare in the future. But I started as a community pharmacist back in 2006. And really, that's when I fell in love with patient care. And I started my practice in Peterborough. And in Peterborough, we were really resource limited at the time and probably continue to be. But, you know, it's a very rural area. And I do remember at the time where we'd have patients, because of lack of doctors or access to physicians in the community, where they'd have to go to the ER to be able to get just their chronic medication prescriptions refilled. So I think coming from a place where you are so resource restricted gets you, and especially as an entrepreneur, starts getting you in a place where, you know, what are the things that I can do, or what are the, you know, what are some of the technology or anything that could be out there that can help me offer more, or can help me get around, you know, the restriction of resources to be able to provide better patient care. And that's really when I started on my journey of innovation and entrepreneurship. And that's what got me excited about AI. Started off
Marwa?
as, oh, yes.
Sorry, I'm interrupting you, but are you advancing your slides?
I am about to advance. Yes.
Oh, okay, perfect.
Thank you,
Okay,
Kareem, for
okay.
letting me know. Thank you. So started off my career co-founding a pharmacy that specialized in providing supports for organizations supporting people with developmental disabilities. This is not the place where we started. We started in a small little two-person facility. And I just wanted to show a bit of the timeline of how, as we grew, we started to implement things like automation. So as you can see here, this is our facility in Scarborough. Really invested heavily in automation. I know we're talking about AI, and I will discuss this a little bit later, but when we talk about, you know, what falls under AI, and as you know, the different definitions that people have for what falls under AI. So as you can see in our facility, we've used, one of the things that we really wanted to invest in is we wanted to make sure that we had less errors, and that we were able to support more patients, more customers, more clients, but by, you know, not investing as heavily in human resources. And really, when you think about, you know, reducing errors and how humans are not infallible, and how errors are much easier when, you know, you're a person or a human who can be easily distracted, and your error rate can, you know, vary based on if you had a long day, if you're tired, if you hadn't had your lunch yet. And we really wanted to eliminate a lot of those factors. And I think that's important to note, because when we consider AI tools for the future of healthcare, is really that piece of standardization, and how we're looking at tools to be able to support, you know, providing standard patient care. So these are just some of our machines in behind the scenes. So here we have our SynMed machine, which through, you know, gravity and everything, does the blister packaging, automates blister packaging, as well as a Prada machine, which automates vials. We have a PackMed machine, which automates pouches, as well as a PackVision machine. So as you can see here on the right, so the PackMed so the PacMed produces the pouches, and then the PacVision machine takes pictures of the pouches, and through, some form of automation and rules-based AI, it is able to identify if there's any deviations in the tablet. So when we also talk about, AI and AI tools and how we have to continue to double check them and the different layers we have to add to make sure that whatever output is coming out is, error-free as possible. This, I think, is a really good example of that. So we have a machine that automates the dispensing. There's a lot of different checkpoints. We have another machine that takes a picture and double checks that first product. And then we ensure that there's always a human in the loop that is double checking the final product. My journey also took me to co-founding a software solution that supported pharmacy workflows. So at one point, we got to a point where we were growing too fast. And, I had a co-founder that joined that did computer science. And he said, you're never going to be able to scale the way that you're doing things. A lot of the things that you're doing are, direct, when you're doing direct patient care or one-on-one education, or, people are collecting too much information on paper. How are you going to scale these processes as you grow? And it really was kind of a turning point to us where, looking at the business model, if we have to continue hiring pharmacists, if we continue hiring technicians, and I'm not saying eliminating the healthcare human resources, but it is, it's a hard thing to find, but you're not able to, meet that exponential need to be able to provide care for your patients or more patients when you have such a limited healthcare human resource. So we dabbled a little bit. We had an EHR. We also built an EMR solution as well as an education portal, and collecting data, being able to really, in the beginning, more rules-based AI, where it is, based on something, therefore something else. And so a little bit of workflow management, a little bit of clinical decision support, which took me to my next part of my career, where I kind of left healthcare for a little bit, worked on Polymatics, which really was a decision support tool and a predictive analytics model. So it's AI-powered pricing platform. We ingested a lot of information on, social media platforms, as well as, buying and price sensitivity of individuals to be able to make recommendations or predictions on future price sensitivity of certain individuals. So it really was an interesting thing to be a part of, especially without the healthcare background. And that's really what excited me about joining that team. And with Agate, it's more something where I get to actually be exposed to a lot of what's going out there, different teams, different people who are looking at problems in a different way and are also looking at solving those problems in an interesting way. And I think that's really what got me a lot more excited about AI and the possibilities, because there is really so many case possibilities that AI can be used in. Obviously, we have a lot of low-hanging fruit, but there's also really big picture groups and people out there trying to solve really big problems. So I'm going to pause and take a moment to reflect on what the definition of AI is, because I do believe the more people that I talk to, I think people think of AI as everybody has a different definition of AI. And in reality, we are not really where AI, the real definition, is supposed to be. So when we think of AI, we're thinking of, human-like computers that can make certain decisions on their own. And it is what you're picturing it, that future view. But we are definitely not there yet. And there are people that picture, Rosie from the Jetsons. There are people that picture iRobots with Will Smith. But really, essentially, the AI that we are mostly talking about these days is really algorithms, really sophisticated algorithms that learn from data, identify patterns, and make predictions or decisions. And that essentially is machine learning. So if you're talking to a purist, somebody who's like a pure technologist, computer science, and you say AI, they usually cringe, because that's really not what we're not really where AI is supposed to be yet. So a lot of what we talk about is automation, as you saw, in automation in our pharmacy space. There is, the capabilities will provide some enhanced efficiencies, certain mundane tasks or repetitive tasks that we're trying to get rid of, and also being able to provide that standardization and in standardization in predictions based on the data provided. So what, as I mentioned before, and I kind of alluded to that, the reason I got really excited about AI and I really have kind of submerged myself in it is this challenge of how are we going to scale healthcare, and how it is really becoming more of a strategic importance in our healthcare landscape right now, not just Canada, but globally as well, where, we've seen it after the pandemic, and there's really been a lot of workforce challenges in an aging population. So there's been a report by Deloitte, I think it was commissioned by CMA, and the report by Deloitte, which predicts that elder care in Canada will double in 10 years. But unfortunately, the healthcare human resources is not going to be able to catch up. So what are we doing? Obviously, there's a lot of different strategies that are happening where we're training more doctors, we're training more nurses, more healthcare professionals, but is that going to be enough to be able to catch up with the demand? And I think a lot of people, me, myself, I hypothesize it's never going to be enough. So when we look at AI and AI tools, we're looking at them to be able to optimize resource allocation, to optimize care delivery. How are we going to be able to scale the healthcare professionals' capacity in our organizations, in the healthcare landscape? And that's where I look at AI right now as a solution. And so one of the things we'll talk about is really the importance. And I know one of the things a lot of people worry about, and you hear some of these things where, is AI going to replace my job, or is AI going to replace me? And, I'll kind of discuss the importance of human in the loop as AI is used as a solution to augment and enable the healthcare professionals' capacity. I'm gonna do a bit of, so obviously this is not an exhaustive list. These are just the solutions that I've had, passed along my way, or I've had the pleasure of consulting for. But, some of the solutions that are out there, and especially focusing specifically on community pharmacy. So we have certain solutions that are scheduling solutions. So right now, with pharmacists being really overworked and doing a lot at the same time, and now with minor ailments and having expanded scope, a lot of solutions are coming out to be able to support scheduling. So there's one called MedMe, Medisys. Those are both homegrown, and this really takes off a lot of that administration stuff that really a pharmacist does not need to be doing, and it's taking up a lot of time from pharmacists and technicians, where they can focus more on that clinical management of the patient. There's some workflow management solutions. So those are AI solutions that are managing and streamlining a little bit more of the pharmacy operations. So that could be inventory management, and how difficult right now it is with all of that drug shortages and us having to consistently manage that, and also things like like billing. So Box Labs, if anybody's familiar with that, also another homegrown solution that is trying to tackle that problem. We have digital therapeutic solutions. So those are applications that are offering a little bit more of a personalized treatment plan, monitoring patient adherence. So that's like chatbots, or that are supporting the smoking cessation or diabetes care. There's information management solutions. So those are ones that are AI is providing a bit more of an efficient handling of the analysis of patient data. So this is actually kind of like where it's a little bit more exciting. So there is a solution that I had a discussion with one of the co-founders, and the solution is called ASIFA. And it basically has consumed so much data that you're able to give it a list of the drugs that a patient that is on, and it will come up with all powered by AI, come up with all of the, the drug problems, all the counseling tips, everything that you would need to provide for the patient. So I thought that one was really cool, and really kind of imagine being able to have that kind of as your fingertips, and how much time that would take off from the pharmacist to be able to actually do a lot more direct patient care, discussing with the patient, getting the correct information that would support the pharmacist in being able to make that some of those clinical decisions. As well as there's another one called Pharmasol, which acts more of a chatbot, but it's more on the patient side. So it's patient information management. So it's supporting kind of like the chatbot that was just discussed with the smoking cessation, but it's providing patient with more counseling information based on like specific drugs or specific disease management. And there's also First History, which some of you may, that one is more clinician based and more kind of managing the information that's coming in from a patient to be able to manage it in a way and also present it in a way that supports the clinician in making certain decisions. Clinical decision support solutions. So those are ones that once you input certain data about the patient, about what medications they're taking. So let's say, for asthma, how often their exacerbations, what inhalers they might be on, what triggers they are, would, spit out a recommendation on how you can support that patient. So very specific, I'm going to underline that word decision support solutions, because a lot of this tool and a lot of these tools right now in their infancy, should not be making decisions on their own. There has to always be a healthcare professional in the loop. So it's a decision support solution. So it'll spit out a recommendation. It will tell you all the reasons based on guidelines, and then the healthcare professional in the end makes the final call. Remote patient monitoring, many of you are very familiar with that. Any smartwatches or even the Freestyle Libre right now would be one of those. And then the really, really cool one, which I haven't actually had any firsthand experience with yet, but precision medicine tools. So those are tools that will incorporate pharmacogenomic testing. So it's, the ones that do the drug gene interactions. So it requires these ones very sophisticated combination of genomic technologies, bioinformatics, and clinical decision support. I believe IBM's Watson was trying to do something like that. Not sure how successful, but that is definitely a really interesting field that I feel like, in the future might really blow up when you think about precision and personalized medicine.
Marwa, I'm just gonna cut you off there. Sorry, this is really fantastic, and thank you so much for diving into some of those solutions, particularly I think for community pharmacy. I think a lot of people are quite interested in that. But just in the name of time, and just to make sure that we also have time for lots and back and forth with the audience, I'll maybe just ask you to wrap up and hand it over
Sounds good.
for some reflection.
Absolutely. Yeah, can do that. So I'll go over this quickly. Some of the barriers to adoption I think is really important to address. So, there's the black box algorithms, there's data access limitations, regulatory barriers, obviously. And then in the end, the kind of twist, this is a really great article if you wanted to learn more. Avi Goldberg is a professor right here at U of T. And, the twist at the end, which might be misaligned incentives, some more barriers. This is a really cool and interesting book, and it's really on Clearview and how they were able to collect billions of images off the net, as well as use open source code to be able to, have a facial recognition app that they sold to law enforcement. Really cool. Some of the organizations that are building basically how AI is going to be used within the Canadian healthcare landscape. CIHI, Canada Health Infoway, Ontario MD is looking at developing an assessment for health technologies for physicians. CIFAR is building a pan-Canadian AI strategy, AI for Health Task Force. And as well in Toronto, we have the Vector Institute. In Alberta, we have AMI, and in Quebec, we have Mila, which are really great resources. So in the end, how are we going to be able to capitalize on AI? I think with AI, we're going to be able to really be able to kind of hone in and emphasize that synergy between AI and healthcare professionals. We want to make sure that we are focused. Oh, sorry. This one here. So I love this one. By augmenting human performance, AI has the potential to improve productivity, efficiency, workflow. And what I'm most excited about, this is by Eric Topol, is using the future to bring back the past, which is restoring the care in healthcare. So being able to really optimize our empathy, what we're good at as humans, being able to provide that direct patient care, but using AI tools to, enable us in that future. So thank you very much. If anybody wants any extra resources, you can contact me and I will be able to provide those for you.
Thanks, Marwa. And please do feel free to
problem.
put any of those resources and links into the chat. I think I know those last few slides were really jam-packed with information, so please feel free to share that.
Absolutely. Yeah.
Kareem, you've heard a little bit about a few case examples from both Osnat and Marwa. You've heard a little bit of, maybe seen a little bit of the chat in our Zoom call just about where things are going. I'll turn it over to you for some reflections.
Yeah, no, thank you so much. That was really amazing presentations. I really enjoyed both of them. Thank you very much. You guys are pioneers, absolutely. And I think that was wonderful to hear. I think, the things that came to mind for me were, how fast AI is accelerating things, right? So you're getting this, and of course, I think somebody said that, so I'm not saying something new here. I think somebody in the chat said that, but I think, and that led me to think about a couple of things. Marwa talked about scalability and how we can scale our activities and standardization. So I thought I really like that concept of standardization, because I think when I think about standardization, it means that the quality is so good that you can give it to somebody with lower risk. And risk is an important concept here, because as we start to take it outside the hands of, if you go globally, right? Like, I mean, I'm thinking global because AI should be taking us global. And when you start getting into situations where healthcare professionals are not as well trained, standardization really helps to provide patient safety. So I think that's an important concept for us to think about, and where AI can help us in that. The other side of scalability is the human capacity to cope with change, right? Because everything is changing so fast. How do we as humans cope? And, I like to think of things like light switches and microwaves, right? Somebody who has never seen a light bulb or had a light bulb, within 2 seconds, you know how to use a light bulb, a light switch, and you can always use a light switch. Or, somebody introduces you to a microwave oven, that's it. It's easy to use. It's 1 or 2 buttons and you get something valuable. So I think one of the things that we have to think about is, how do we create these standard interfaces or easy to adopt interfaces that is very easy for a human to adopt, because it's just some sort of standard interface. And I think that's something for us to think about as we move into the world of AI, is that, just as we've had over the last 30 years, graphical user interfaces that we've all kind of gotten used to. And when you look at the smartphones, how quickly we got used to that, we're going to need to think about what's the interface that humans have with AI, and how does that get simplified so that there's observability, that we can actually see what's going on, so that when I click the switch, I don't have to see all the complexity, but the light goes on, or the food gets heated up, and so forth. And so I think we need to have that kind of thing. The other thought that came to my mind as I was thinking about this was that, there's huge amounts of opportunities for equity and inclusion here, right? I think, I must say, I really like that polymatics, intelligent pricing thing, Marwa, because I'm thinking about this and I'm like, yeah, that makes sense. In the West, we don't like that because we think standard pricing and, equal is equitable, but equal is not equitable. And, if you go to the markets of Cairo, or you go to the markets of Tanzania, you negotiate, right? You haggle, and the price comes down, or is as is needed for different people. And I think perhaps we need to rediscover those kinds of things as a society, because I think affordability of these kinds of things is an issue, and we know that it's an issue, and we need to, fixed pricing is great when you have when you have an equal society where everybody has, very close to the same kinds of resources. But the reality is that today in the Western world, we don't have that. I think, 50, 60 years ago we did. Today we don't. And I think we need to think about how do we respond to that? And I think artificial intelligence can really help us in making our societies more equitable if we wish, but can also make them less equitable if we don't plan for it. So I think that I see as being an ethical area. And I'll just make one more comment, then we can have other people also jump in. Is I really enjoyed, the discussion around the motivational interviewing. I think that's such an important area. I myself am involved in a research project around diabetes prevention. So I'm interested in how do we take people who, just walking down the street, innocent, but at risk of developing diabetes. How do you inform them that they have diabetes? How do you educate them, motivate them, get them to engage? How do you get them to set a goal, and how do you get them to make that lifestyle change? I think it's very similar to the tobacco kind of cessation kind of story. And so I think obviously you guys are pioneers in that area, but I think what you're doing there has applicability across multiple areas. And when I look at, for example, even diabetes prevention, I'm also thinking, yeah, the things that prevent diabetes also prevent hypertension, they prevent dementia, they prevent cancers. There's a lot of positive stuff around that. So I think, some of these things can really scale up if we design them correctly. And I think we should be thinking more broadly because these AI is a general purpose tool. It's not necessarily it's not a hammer. It's much more broad. It's more like a personal computer than it is like a hammer or a saw. And I think we need to open up our minds to that kind of thinking. So those are just my early reflections, and but would love to have other people engaged in the discussion.
Thank you so much for those thoughts, Kareem. I think you touched on a number of things sort of from our chat and then also some of our audience questions. So Marwa, Osnat, I'd love to invite you to comment on some of Kareem's comments, anything you've seen in the chat. But perhaps just while you're gathering some of those thoughts, I think one of the things that sort of has stood out to me, also just seeing some of our chat conversations, is the variety of tools and technologies that are really out there. And so I guess one of the things that comes to my mind is how do we test validity and rigor of those tools when integrating them into practice? And then Tracy had made a comment in the chat of sort of, as a community pharmacist, you might feel very overwhelmed in picking one of those tools. And are there any best practices or guidelines that exist to sort of facilitate uptake of the right tools, whatever right means in today's context?
I can start. So in terms of assessing validity, rigor, I mean, right now, I believe in the landscape, and especially as Kareem mentioned, everything is changing so fast. And unfortunately, regulations and policy have not caught up. So right now, really, the onus is on the organization. The onus is on the healthcare professional. The onus is on where you're working. And there are a few resources out there. So the Vector Institute has a toolkit on how you can assess how AI tools, whether you are somebody who's developing them or whether you're somebody who's implementing them in the organization. So I believe Vector Institute, Canada Health Infoway also just published something in September. I mean, with AI tools, really it is based on what tool you're using, the type of tool. So if you're going to be using ChatGPT, for example, you need to understand, or any other type of LLM, you need to understand its limitations. You need to understand its risk of, having some hallucinations, which is misinformation, But if you're using a tool that is within your organization, something that's already been assessed for validity, one of the things that there's different places also that you need to be validating. So it really requires a lot of expertise, because you want to look at the data that they've used. Are they representing of the population that you are caring for? Are they using the right labels? Are they using the right outcomes, the right gold standards? Have the gold standards changed since, the last version of this tool is out there? And that's the other piece is, we can have a tool that is gone and it's been assessed, but then now you're using a version that's three versions later. So it really is changing too fast right now, and the regulations aren't out there. And really, that's why, as we've mentioned, it is that importance of a human in the loop. And they've said, I love the thing, which is the AI tools are as good as the experts that are using them. And there's different levels of expertise. There's the expert in being able to use the tool in itself. So are you a user that is able to give the right inputs to be able to get the right outputs? Because that's an expertise within itself. And are you somebody who is an expert in your subject matter to be able to, when a tool gives you an output, to be able to challenge it, to be able to wonder if that's right, to be able to ask it for the right resources? So basically a lot of words to say. It's really difficult right now, but there are resources out there. And really the most important part is that you are a subject matter expert in what you're working with.
Thanks for that, Marwa. Kareem, Osnat, would you like to add?
Yeah, thanks for Kareem and Marwa for your comments and a great discussion. One thing that comes to mind, when we have to sort of pick and choose, we have so many AI tools that are coming into the market. We have to pick and choose what to use. Personally, I find that I do, give some credit to the ones that are based on good science. And I think that this is a really, really important factor. For example, when we talk about conversational agents or chatbots for mental health support, we know that there's been one that's been in the market for a little bit of time that's called the WooBot. And that had a good, solid sort of scientific academic basis. People who developed it were CBT experts, psychologists. This was done in academia, and papers were published on this. So I think it gives me the sort of the comfort that, if I recommend, this chatbot to my patient, I know that it's sort of tried and tested in a way that meets my sort of scientific, the scientific rigor, right? I do know that it has helped other people. And I think continuing on this point is we know that what's happening currently in the private sector, in the commercial sector, can be quite the opposite. There could be quite a lot of companies that are interested in value, making money, right? Profit. And then, they sort of cut corners, right? This is not really tested in a scientific manner. This perhaps was tested on a very small sample that was paid to, do this kind of testing. And I can't really, vouch for their results. I don't know whether this tool will be helpful. Could it be harmful? And I just want to give an example. I forgot the name of the chat of I think it was an online support platform with a chatbot in which people were conversing with a chatbot, whereas they thought they were conversing with a human provider. And, this was in one of the questions here in the chat just earlier. So I think the ethicality of how these chatbots are produced is also very important, and how commercial chatbots, the ethicality of their use, right? Do they disclose certain information? Do they have any sort of crisis buttons in case a person is showing some suicidality or some other safety concerns? So I think those are really important, important factors to weigh in when we try to adopt certain AI tools, and also recommend it to people that we work with.
Thank you. Kareem, would you like to add anything to that?
No, I think I'd like to hear from the audience, and let's hear what they think about some of what we've talked about today.
Yeah, there is one question. There's many questions, and I'm really grateful for everyone having lots of back and forth in the chat as well. But just sort of tying into sort of the last question, I'm curious what your thoughts are on the role of sort of licensing regulatory bodies for healthcare professionals governing sort of the role of the chatbot in place of a healthcare provider. I don't know if that's come up in any of your professional circles.
It hasn't come up in any of my professional circles, but it's definitely something that I have been thinking about. And what is the role of? So it's interesting because in the UK, it's very clear. Any kind of AI or tool like that is regulated and cannot be used by non-regulated healthcare professionals. And then basically the idea is that you have regulated healthcare professionals using these tools as learned intermediaries, meaning that they are supervising the AI, and that the AI doesn't make autonomous decisions. And there's a big move toward this whole explainable AI type of thing, to say that AI shouldn't be a black box. It should be able to explain to you how it came up with its reasoning. Now, I think right now that's relatively easy, because the reality is that much of the data that we collect right now is actually evidence-based data. It's things that we collect because we know that it's proven that this is useful in healthcare. But I think as we start to go forward into things like genomics and proteomics, and where we collect everything about you, and so we collect so much information that only maybe 0.5% or even a 1,000th of it is actually valuable, and the rest of it is all, kind of just there. All of a sudden, that creates all sorts of that will create all sorts of issues, because, now how do you do that? What if you find something but you have no proof that that actually means anything, or that it's going to be operative in a particular situation? For example, you find something in a genetic code, but it may not be penetrant. It may not show up in your phenotype. It's just in your genotype. How do we deal with those kinds of issues? I think will require. So I think that's why they have these learned intermediaries to provide that kind of buffer between, this kind of scary world where, there's so much knowledge that doesn't have evidence behind it. So I think that's one area. And the other area that, is, well, what about things where they're not regulated, right? So for example, I work in the area of preventive care, diabetes prevention. It's all lifestyle. So there's no necessity for a doctor or whatever. How does that get? And oh yes, sorry, and of course, North America, the Americans don't regulate that kind of thing. So, right, so they're willing to say that, anybody, an organization that has some sort of tool can come in and provide service. So that's happening, for example, in diabetes prevention. There's lots of companies that don't have doctors that provide diabetes prevention stuff using health coaches and other non-regulated healthcare professionals. So I think we're going to see a lot more of that kind of thing happening in North America. And I think we'll see where artificial intelligence gives people, non-professionals, capacity to act like professionals, and may even be able to not just predict things, which I call, like prediction is kind of like diagnosis. And then how would you also prescribe things? How do you make recommendations? And that prescriptive analytics is something that gives you recommendations. It's almost like a treatment plan, but it may not be pharmacological treatment, or it may be pharmacological treatment. And then you say to the patient, here's a pharmacological recommendation, go to your doctor and ask them for it. So I think, we're going to see a lot of that kind of devolution of decision making.
Yeah. Thank you so much, Kareem. And I think it's a couple seconds to 5 p.m. So unfortunately, I'm going to have to close this out for today. But thank you so much. I'll just do a brief thank you to everyone online. Marwa, Osnat, for your presentations. Thank you. Kareem, thank you for your very thoughtful discussion. And truly our audience members. And I'm so happy to see so much chat online. And I really hope that we can carry this forward in the future. Zubin, I'll pass it to you for some final thoughts.
And thank you, everybody, for a really interesting and stimulating session, not about the future, but about the present, and giving us a lot to think about. To our audience, please do join us for our next speaker series events. We have quite an action-packed agenda in the months ahead. We'll have some interesting topics focused, for example, on advocacy in pharmacy. And so that'll be a very interesting upcoming session. I hope you will all attend. For now, we've got a lot to reflect on. Thank you again, Kareem, Marwa, Osnat, and Annalise for organizing and hosting today's event. Thank you all, and we'll see you at our next CPE Speaker Series event. Good night.